Hi, everyone, and welcome back to the next episode of TILLY. I'm your host, Marissa. Some of you may already know me as Lupus Chick, and TILLY is brought to you by the Lupus Foundation of New England. It is a weekly episodic series, and we speak with all different types of experts, patients on a variety of topics. Today, we are so excited to talk about one of the most common topics that are brought up in our communities, and that is pregnancy and lupus. And we also have a special guest here, Dr. Laura Tarter. She is the Director of Pregnancy and Reproductive Health at Brigham and Women's Hospital Lupus Center. She is also the Assistant Professor of Medicine at Harvard Medical School. So it is so nice to meet you. Thank you so much for being here with us.
Thank you. It's great to be here with you. Thanks for having me.
Of course. I'm sure everyone's really excited, and I'm sure there will be a lot of questions. You can leave your questions in the comments below, everyone, just so you know. If you can just give us a little bit of your background and tell us how you sort of fell into the whole lupus world as a director of pregnancy and reproductive health, that would be great.
Yeah, of course. So I'm a physician and I'm a rheumatologist. And I have for many years been particularly interested in the care of patients with lupus and also in teaching medical trainees, so medical students and residents and fellows, about rheumatology in general, and particularly about the care of patients with lupus. And then through my experience taking care of patients, I ended up taking care of many young women who were interested in expanding their families or starting families. And I learned more and more about pregnancy and lupus in this setting and have become very interested and dedicated to the care of these patients.
Thank you. I appreciate that. It's so nice to have someone that can speak to this topic because it really is one of the most common area of questions that we get. And I wanted to just kick off with some of those questions. I feel like one of the absolute most common is, can I start a family or can I get pregnant if I have lupus? So on that initial visit, if someone brings that up to you, what is something that you would say to them, or how would you explain the situation to them?
Yeah, absolutely. So, I think the good news about this is that in recent years, unlike 20 or 30 years ago, where we had very different treatment options and very different management options for patients, we now can feel very confident that most people, most women with lupus can absolutely start families and have children and have a completely normal experience in that way. There are, of course, certain scenarios where we would potentially advise against pregnancy, but those scenarios are rare. It's not the majority of people at all. The vast majority of our patients can become pregnant and can do very well and be able to have children as, if they want, up to them, of course.
That's amazing. And I'm sure that will ease a lot of stress and fears for some of the people that are watching tonight. I think
Yeah.
another, oh, I'm sorry.
Oh, sorry. Related to that, I think that some decades ago, I think that women with lupus were often told that they should not start families and that they should not become pregnant. And just a very important thing to sort of make sure your viewers know, that is definitely not the case now. This is a situation where, for sure, people need to be evaluated by their physicians and followed really closely and really think through potential risk factors and make sure they're on safe medications. But most people, most women with lupus can start families just like anyone else.
So when someone is ready to take that step, are they typically followed by their rheumatologist and a high risk OBGYN?
Exactly. So what we do with all of our patients and what the recommendation is from the American College of Rheumatology is that all women with lupus should be followed by a maternal fetal medicine specialist. So that's a high risk obstetrician, which sounds scary to say high risk, and it doesn't necessarily mean it's a high risk situation, but it's an obstetrician who is specialized in taking care of mothers, so pregnant mothers who have medical conditions. And that is really important to have that additional care. So we at the Brigham typically refer our patients to talk to a maternal fetal medicine, even a specialist, even before they become pregnant, to go through their medications, to go through potential risk factors, to talk through the process to help people know what to expect during pregnancy and what additional screening might need to be done and what kind of follow-up will need to be done.
Okay, so you mentioned medications, which is something I wanted to talk to you about.
Yeah, of course.
There are, now we have several medication options for lupus. So
Mhm.
are there certain medications that patients are not able to take if they decide that they're going to get pregnant or start a family, or are most people able to continue treatment through the pregnancy? How does, tell us a little bit about that.
Yeah, absolutely. So, our data for medications in pregnancy are imperfect, but we have quite a bit of data about multiple medications at this point, which is very helpful in terms of trying to figure out what the best options are for individuals as they think about pregnancy in the setting of lupus. So, the American College of Rheumatology, our professional organization, published guidelines last year going through in great detail pregnancy in patients with autoimmune disease. So lupus, but also rheumatoid arthritis, vasculitis, a number of different conditions. And a big part of this effort was to also go through very carefully all the data about medication safety. So this is a really great resource and something that any physician can find and look at and help a patient sort of think through the best medication options. So we have certain medications that are what we call teratogenic, which means that they would be very potentially damaging for a developing baby. So it's really important that women with lupus who would like to become pregnant be off of these medications before becoming pregnant. So the big ones that we particularly think about are methotrexate and mycophenolate. So both of those medications are known teratogens. So it's really important that anybody who wants to become pregnant not be on those medications. And just to clarify, this doesn't mean that you can't take these medicines and then stop them a few months before trying to become pregnant. It just means that you should absolutely not be taking these medications if you're actively trying to conceive or become pregnant.
Okay,
So,
that's information. Thank
yeah,
you.
of course. Now, on the flip side, there are a number of medicines that are absolutely considered to be safe with pregnancy. And so several different studies have shown that women with lupus do better in pregnancy if they have stable, well-controlled disease for 6 months prior to conception. So what we like to do is to try to talk over things earlier with patients. So this does mean a little bit more planning than other people might have to do before pregnancy. But we go through medications, and once somebody has stable disease and is interested in becoming pregnant, we change medicines to medicines that are safe for the baby at least 6 months before a woman tries to become pregnant. And I think that is really important because multiple different studies show that patients with lupus are less likely to flare and are more likely to have full-term pregnancy, so less likely to have preterm labor if they have well-controlled disease. So that is one really important step. The other really important step is to make sure that unless there's a good reason not to be, that you're on Plaquenil. So Plaquenil, which as you all know is a mainstay of therapy for lupus, and most of our lupus patients, unless there's a reason not to be, are on Plaquenil. So several different studies have demonstrated that women who stay on Plaquenil during pregnancy are less likely to have flares, and there's an association with a decreased risk also of having preterm labor or preeclampsia from being on Plaquenil, which is important, of course. So we try to make sure that everyone is on Plaquenil, and then the medications that we typically use for women who are pregnant or trying to become pregnant would be prednisone. Up to 20 milligrams a day is considered acceptable because up to 20 milligrams a day doesn't cross the placenta in high quantities, so is safer for the developing baby. There are some older studies that suggest that there may be an association with potential risk for cleft palate with first trimester use, but newer studies really don't support that. So overall, we're pretty comfortable with prednisone at the lowest dose possible, but up to 20 milligrams as needed. Azathioprine, which is also called Imuran, we use frequently. It's been well studied and is safe in the setting of pregnancy from all the data we have. Tacrolimus is another medication that we use for lupus nephritis at times in pregnancy. And sulfasalazine, which can be helpful for arthritis. So those medications are all considered safe to take throughout pregnancy. And then in the case of a big flare that could be organ threatening or life threatening, especially after the second trimester, we sometimes use rituximab if necessary, but that really is only if truly organ or life threatening. And then Benlysta, the recommendation is to stop at the time of conception because we have insufficient data to support use throughout pregnancy, but it doesn't need to be stopped in advance. It just needs to be stopped at the time of conception.
Wow. So thank you so much. That's amazing information. So it sounds like there really are a lot of different medication options, which I think offers so much hope to everyone here that's listening. And like you said, getting pregnant and starting a family today and the information that we have and the therapies that we have compared to decades ago, it actually seems possible and it gives women hope. So that's amazing. I did want to ask you, a lot of people are curious when they actually get pregnant. Do you tend to see that their flares calm down, or do most tend to have more flares during that time?
That is a great question. So, the classic teaching in rheumatology from some decades ago, from the early studies that were kind of done looking at this, so that suggested that patients, so people with rheumatoid arthritis who became pregnant were likely to go into remission, and people with lupus were likely to flare. Now, this is probably not really true. So larger studies that have been done more recently suggest that most people with rheumatoid arthritis do tend to remit in pregnancy, but not everyone. And with lupus, if you look at, there are a number of different studies sort of synthesizing all this data. The risk of flare is 40 to 65% in pregnancy. So there definitely is a risk, but there's a background rate of flare in lupus among everyone with lupus of 0.5 flares per year. So a flare every other year, basically, if you look at like cohort studies of many, many different people with lupus. And of course, this isn't everyone's experience. This is if you look at composite data from many different people. So there is a little bit of an increased risk if you look at that in pregnancy, but it's not a markedly increased risk. But there is enough of an increased risk that we are really vigilant, and it's very important that women with lupus who are pregnant see their rheumatologist and maternal fetal medicine specialist frequently. We typically try to do labs every 2 to 3 months just to make sure that everything looks stable, or more frequently if needed, but that's sort of our standard protocol. And then also postpartum, people can flare. And so it's really important to follow up closely postpartum to make sure that everything looks okay at that point.
So something that you had just mentioned actually segues right into our next question, which is, and you had talked about it earlier. What is it like to be just pregnant and then pregnant with lupus? Like, are you going to doctor's visits more? Are you having more tests? Are you having different tests that someone that's healthy wouldn't necessarily have when they're pregnant?
That is a great question. So I'd say overall, I think it is important for women with lupus to realize that they probably are going to have to go in more often. There are, more doctors involved, more testing, more people who are worried and being super vigilant, more doctors, that is, right? So in general, I think patients with lupus do end up having to go in a little bit more frequently for checkups and labs. The other thing is that we always check antibodies called SSA and SSB, which are also called Rho and La, which many of you I'm sure know about because about 30% of women with lupus have these antibodies. And these antibodies can be associated with a risk for congenital complete heart block in a developing baby. Fortunately, the risk is very low. So depending on what study you look at, it's between 1% and 3% in a first pregnancy of a woman woman who has these antibodies who has never had a baby with congenital heart block in the past. But, that's enough of a risk that we do recommend that women with lupus or Sjogren's or other diseases who have these antibodies should have fetal echocardiography done typically between weeks 16 and 28 of pregnancy, sometimes 16 and 26, it depends on the center. And this is typically done in a children's hospital setting by a pediatric cardiologist who women with lupus usually are referred to these specialists by their maternal fetal medicine specialist. So that is definitely more because those tests have to be done every 1 to 2 weeks. So that is a lot more screening, but there's no risk to this as it's just an ultrasound test.
Right. Okay, that's good to know. So you also mentioned something before about after giving birth. Now, you mentioned an increase of flares. Does this have to do with hormones? And also, like, how often do you see this? Like, if you had 10 patients, can you give us maybe an idea of how many might flare after giving birth?
Absolutely. So is this, first, to answer the first part of that question, is this due to hormones? We think probably yes, but we don't fully understand the interplay of hormones and lupus. So we know that lupus is much more prevalent in women, right? So it's much more common in women than men. But interestingly, it's lupus in women aged 20 to 50, so women of childbearing years, is 9 times more common than in men in the same age range. Whereas lupus in younger people, so in children, the rate of increase in women versus men is more like 3 to 1. And it's the same in people over age 50, so in postmenopausal women. So there is clearly something about hormones that is related to lupus beyond any potential risk based on chromosomes or other differences between men and women. There is something about hormones about those years that is an increased risk. What exactly that is has not been well deduced at this point from the research that has been done. But we do worry about hormonal flux in pregnancy and what role that may play in increased risk of lupus flares. So overall, there are not great studies to differentiate the risk of flare in pregnancy versus postpartum, but we consider the whole thing kind of one time period. So pregnancy through 3 to 6 months postpartum. During that whole time period, there is hormonal variation and increased risk in flare. So in 10 women with lupus, between 4 and 6 or 6.5, right, would flare somewhere in that time period. So it's a real consideration. That could be a very small flare, right, involving maybe a little bit of joint pain that could be treated with a low dose of prednisone, and a bigger, more serious flare.
Okay, so that actually was going to be the next area that I wanted to talk about. If someone were to go into a flare-up, is that right after pregnancy? Would that just be an increase in some of the medications that they were on during their pregnancy, or maybe then because now they're not pregnant, they could actually take something else to stop that flare?
That's exactly right. So if somebody flares during pregnancy, we have sort of the armamentarium of medications we discussed, right? So medications that are safe for the baby. If it is after the baby is born, postpartum, that a woman has a flare, then there are other medication options. But of course, many of these other options are not safe with nursing and breastfeeding. So that's a real consideration as well. And we really have to think very carefully about those decisions in that setting. Now, of course, if there is an organ-threatening situation, it's a completely different story, right? But if not, then we really try to work closely with patients to make sure that if a patient really wants to breastfeed, that they're able to do that. If a woman wants to do that, they're able to do that. And we try to make sure that we use medications that are compatible with breastfeeding.
Okay, well, it's great to know that there are a lot of different options. I wanted to take it away a little bit from medicine and just ask you more of a lifestyle question, as we know that stress can trigger lupus flares and different symptoms, and having a newborn baby and everything that you're going through can be an area of
Yeah.
stress and time of stress. So what is some advice or just words of wisdom that you would give to lupus patients that are sort of in this season of life?
Yeah, absolutely. So, I think that the reality is that stress can absolutely trigger lupus, right? Lack of sleep can trigger lupus. Lack of exercise can trigger lupus. And as anyone who has kids knows, when you have a newborn, you have high levels of stress, you don't sleep and you don't exercise, right? I have kids, I know, we all know this from our own experience. So I think it's really, really important to make sure as much as possible that you have support and that you have support lined up for after the baby is born, family members or anybody else who can help, and just make sure that that you're able to get some sleep, right? That you're able to maybe have somebody help watch the baby early in the morning so that you're able to sleep a little bit, and to try to keep stress levels as low as possible, which is really hard. And we all know this, and there's no perfect solution to this, but I think this is the case for everyone with a newborn baby. You absolutely need help and need support, and it's really, really hard to do alone. So I think that's something for women with lupus in particular to think about during pregnancy, is sort of think about where they can look to for additional support.
Great. Thank you so much. This has been extremely informative. I just wanted to ask you, are there any other common questions that you normally see that you would want to bring up? Or do you have just any overall words of wisdom for someone that is really thinking, okay, now I think I might actually be willing to try this and actually start a family?
Yeah, well, I think the big thing for people to think about is that, yeah, I think this old message that women with lupus cannot have a family is not true. And we, as the medical professionals, are here to try to support people and try to help women have families if that's what they want to do, because that's everyone's individual decision. So I would say the really important thing, though, if you're thinking about having a family and you are living with lupus, is to make sure that you talk to your doctors about it in advance, and that you have well-controlled disease going into pregnancy, and that you're on safe medications, and that you already have a referral and you're ready to see a maternal fetal medicine specialist. Because when all of those things are done and people are monitored really closely throughout pregnancy and on safe medications, outcomes are much, much better. So I think the big take home is that we are here to support you if you want to start a family. And it's really important to have very close follow-up with multiple different physicians.
Absolutely. Well, thank you so much. This has
Thank
been
you.
extremely helpful. I'm sure everyone here it's nice to have so much information about like medication options and sort of what that journey looks like. If you're not familiar with it, or you don't know someone with lupus that has gone, through a pregnancy, and you really don't have a lot of people to ask. So
Yeah.
we're so thankful for you to take your time. And everyone, Dr. Laura Tarter, she's incredible. So if you have any other
Yeah.
questions, you can leave them in the comments. And I just want to thank you for being on this episode of Tilly and sharing all of this information.
Oh, thank you so much. This is such a fantastic program, and I really appreciate the opportunity to speak. Thank you.
Definitely. So for everyone here, I just want to thank you again for tuning in, and we hope that you feel just more hopeful, and maybe you're ready to talk to your doctor about this process and starting a family or having another child. So stay tuned. Next week we'll have another great episode of Tilly, and until then, you can check out some of our older episodes, and we will see you soon. So take care.